I'm Katie Anderson. I'm 30 years old, and I gave Dr. Watt permission to use this video.
Thank you very much. So Katie is just finishing up our thyroid program. She did a 3-month program that ended up being 4 months, and then we're just doing follow-up for a couple of months with that. So Katie, how did you find out about our office?
My husband got me a massage from one of the Amazon local
Okay.
ads.
And so you came in for that, and then just when we did the evaluation, we found out that there was some thyroid
Yeah,
stuff.
you mentioned thyroid in the seminar, and so
Okay.
I was kind of interested in that.
And so did you come to the seminar then?
Yeah.
Okay. What did you think about the seminar?
It was good. It kind of reinforced a lot of the things I've been reading or researching about.
Okay.
I've been trying to, we're in the, what do you say? We're in the phase of life of having children, and so I haven't wanted to be on drugs. I've had rheumatoid arthritis, so I've been off of those things, but also just got on thyroid medication. And so anyway, I didn't want to be on things I didn't have to be on, so I was just kind of
Okay. So you've been dealing with not only, how long have you had rheumatoid arthritis for?
about 9 years.
About 9 years, okay. And so when you came in, we did the evaluation, we went through everything with you and kind of explained what we needed to do to get the program started. What happened with you at that point?
We decided to do the 3-month program. We waited for a little bit because I was still nursing.
Right. Yeah, and that was one of the things because she was still nursing. There was some things that we really couldn't do yet, so she chose to wait till after she was done nursing her younger one, and then she came in and started care. So, what was some of the things that we did in the beginning that what were some of the things you saw the biggest changes with?
Well, I had been kind of making changes already with
Right.
some things, taking out the gluten.
Right, you'd already, and because we ended up not having to do a gluten test because you didn't really want to do it. It's like, I don't want to eat that if I know it's going to mess me up.
And so we did do the other testing for
sensitivity.
For sensitivity. So that was probably one of the most helpful things to just see kind of what are some other things that are bothering my system. And
so like when we started the program, one of the first things we do is like the dietary changes, stuff like that. You had already started making those. Was that a hard transition for you? Hard to do?
The first round was difficult just because you eliminate so many things, and I'm a small person, and so
you don't have much weight to lose, and she still did lose some.
Yeah, so for me losing the weight, one of the biggest things I was trying to improve was my energy, but that didn't necessarily help my energy because I didn't have
even though you're allowed to eat as much as you can, it's still really restricted.
Yeah, exactly. So that was hard, but I was really good. I've been wanting to do a cleanse for a long time, and so that was the other thing that kind of drew me to your program, was wanting to do a cleanse, but with some
What were some of the things that you noticed in the beginning in terms of what we're doing better? Like, was digestion issues doing better? Was things like, what were some of the symptoms that you saw that dissipated?
Digestion improved. Again, I've been doing some other things too that were already helping that too. But and I think overall energy has improved. It's still kind of hit and miss, really. But
but you are still dealing with 2 little babies.
Yeah, exactly. So there's lots of factors, and that's just life. My joints, though, and being able to see more immediate reactions, I think has been really helpful for after the cleansing, to be able. My knees have been feeling a lot better than they were.
So one of the side effects of actually coming in is that you got actually a lot of benefit from the rheumatoid arthritis pain and things of that nature.
Yeah.
Yeah. See, that's huge. That's huge for people. And I don't have your sheet right here in front of me. Are you Hashimoto's or no?
You said I was borderline.
Borderline, right? Okay, so it was still a little bit positive, but not enough to actually diagnose it.
Which was another reason I wanted to. You'd mentioned that before. You'd seen some of my other results from other doctors.
There's some autoimmune, and usually that indicates that down the road there will be an autoimmune issue with the thyroid. So it was good to kind of jump on it right now. All right. Is there anything else about the program, about what we did in the office, that you thought was kind of cool, different, didn't expect it?
The focus on the brain, and that was another thing I hadn't really realized until we started. It's easy to, once you learn about symptoms, we've talked about this, you think, oh yeah, I have those symptoms. But I think there really were, some of the brain fogginess, and my eyes were really sensitive to light, and I do feel that that's been clearing up a little bit. And it's kind of hard to, I can pinpoint all the time, but I do feel like that's good. So that's been really interesting.
All right. Yep. So we're just finishing up with her. So she just finished up the 4 months last week, and now we're just doing the follow up. And she was gracious enough to do a testimonial for us. So thank you very much.
Thank you.
But she's been a great patient because she's done what we've asked her to do, and that's the hardest thing is when you do stuff, because you only get results when you do what you got to do to get well. So thank you very much.
Thank you.